Again, thank you, Barbara, for giving me the opportunity to share the Baby and Me Tobacco-Free program with all of the folks that work with the smoke-free SC smoke-free smoke-free SC. Baby and Me Tobacco-Free is a program that we began at DHEC, formerly DHEC, now DPH, back in 2016 to help the pregnant and postpartum population with cessation in tobacco use. So we'll go ahead and get started here. So the Baby and Me Tobacco-Free program is a national evidence-based program proven to reduce tobacco-related health disparities among the pregnant population and the postpartum population. The program has been serving mothers and families in the United States for over 20 years and is designated as a best practice by the Association of Maternal and Child Health, which is known as AMCHIP. So South Carolina is one of 14 states currently implementing the program and doing that in person as well as telehealth for our participants. We have a Baby and Me Tobacco-Free program webpage on the SCDPH site. So if you follow the link here, and I'll share this with Barbara, it will give you more information about the program. And we currently we have the capacity to service all participants in the state of South Carolina. So now let's move on to program eligibility. Who's eligible for the program? So of course, there must be a pregnant person, less than or at 36 weeks gestation, current tobacco user, or they have quit since becoming pregnant or quit within 3 months of becoming pregnant. In South Carolina, we also have a support partner component, and that support partner must live with the enrolled mother, and they must use tobacco, of course, as well, but for the support partner, it would only be combustible, so traditional cigarettes. And they must enroll by the 3rd prenatal session and complete the program along with the moms. And so they would be eligible for the 12 postpartum sessions. And then there's no income, age, or insurance eligibility requirement. Now, mom can be, she can use any form of tobacco, e-cigarettes, vapes, smokeless, as well as traditional. So how do we get moms into our program? What we rely on for the majority of our referrals, well, for the majority of our participants is referrals. So we establish referral networks and partnerships and collaborations with OBGYN offices, pregnancy centers, nurse family partnership, different hospital systems, FQHCs, but primarily we get our referrals from our WIC and family planning divisions or programs within DPH. We also have more recently started getting lots more referrals from the actual participants themselves in the form of a self-referral. So we've seen a definite change in the referrals that we get. But this is how we get our referrals. So what we would like and what we promote heavily is with these referral networks to do a quick online. We have a quick online referral process that we have in place, and it takes about 90 seconds. So I want to show you a quick demo of how quick that referral can be, because what the problem we've been seeing with some of our partners is that, you know, they don't want anything else to add to their daily work, right? They don't want something that's going to take a long time to do and something that's cumbersome. So we have this quick online link that the partners are able to refer the patients. So it's a quick demo going to come up here, and we'll just walk through. You go to that the Baby and Me Tobacco-Free page. You hit, let's start in a second. You hit submit referral. Once you hit submit referral, you go down to the state of South Carolina. You select your agency referral, and then you fill out these demographic components, giving mom's name, date of birth, a phone number, an email, estimated due date, and the zip code. We have the capability to service anyone that speaks Spanish as well. List your type of agency, add that information. Agency contact name and number. An email. Additional notes, then the acknowledgement, and you have submitted that referral. So once that referral is submitted, it goes to a database that our facilitators goes to our facilitators, and it will be designated to the facilitators covering the particular area. So we have 3 facilitators that currently implement the program, 2 in upstate and 1 that's covering the Midlands, and then we have 2 of our team leads. They cover the upstate and the PD area too for any referrals that we get out of those areas. So let's talk about the program components. The program is divided into 3 separate components. Those components are individualized counseling, testing and monitoring, and incentives. So with the individualized cessation counseling, the participants will get a dedicated health coach, and the coach works with them through 4 prenatal sessions and 12 postpartum sessions. Those sessions run 15 to 25 minutes with a flexible schedule and location. Telehealth sessions are available for those who qualify. On that first appointment, they would set a quit date, and within that counseling session, they receive positive reinforcement. So with counseling, the facilitators offer a quit plan support. The education and coaching strategies go through components of stress management, understanding triggers and urges, the effects of second and third hand smoke, and creating a tobacco-free environment for the home, and then also relapse prevention, because we know sometimes relapse is a big reason people can't quit. So after they go through their counseling session, the way we verify that mom is indeed or has indeed quit using tobacco is through our testing and monitoring. Now, we have 2 separate options in South Carolina. We have an in-person testing option, and we have a telehealth testing option. So with the in-person testing, the breath test monitor the CO levels to track the progress and show success. So in the in-person sessions measure CO using the handheld monitor that you see here. What we have is the participants blow into this device, and it puts out a reading, and there's a certain scale that mom should be on if she is considered a non-tobacco user, and if she's a tobacco user, it would register a different number on the scale. Our telehealth sessions utilize a mobile device, and so it's an app that the participants download, and this is the device that they would blow into, and it sends information to a dashboard that the facilitators monitor. So we are able to see the CO reading for the participant from the remote session. We have saliva tests available for any mothers that use e-cigarettes or vapes, because our handheld devices and our remote device would not pick up any cotinine levels. So we would utilize the saliva kit for that measurement. And this saliva kit gives us a positive or negative result for tobacco use. At the first postpartum session, support partners begin testing and continue with monthly testing. So after mom completes the 4 prenatal sessions and after she has baby, and then that's where the support partner would be able to come in to participate in the program. So our incentive. So the good thing about this program is not only is mom quitting, but we are adding an additional benefit to it. So mom, uh, after her second prenatal visit, she would be eligible for a $25 diaper voucher. Well, for diapers and wipe. So at prenatal session 3, so she's come to the first session, she set a quit date. She's come to her second session. She's tested tobacco free. So when she comes back to her third session, she's eligible for diapers and wipes as long as she tests tobacco free. Mothers can receive up to $350 in digital gift cards if they remain tobacco free through the entirety of the program. And so again, the entirety of the program is 4 prenatal sessions and 12 postpartum sessions. So we see mom roughly at least 16 times throughout the life of the program. Enrolled partners are also eligible for the gift cards, and they receive up to 300 because they are only coming in at the postpartum phase. So they wouldn't get the benefit of the first 2 sessions, well, the third and fourth session in the prenatal section. And again, the voucher is a digital one that is sent to the participant's phone and redeemable at Walmart and walmart.com. So just to give you a little bit of background about the program, we started back in 2016 as a pilot in the 4 counties in the state with the highest rates of smoking, during pregnancy. And just for information, I'll share what those are. They were Oconee, Cherokee, Lawrence, and oh my goodness, it slipped my mind. Oconee, Cherokee, Lawrence, and Union. So those were the counties with the highest rates of smoking during pregnancy back in 2016. They might still be, I have to look back at that data. And since that time, we have had 36 program graduates. That means these moms have been with us for about 16 months or more, just depending on when they come to us. And there have been 44 babies born to tobacco-free mothers. We've had over 500 participants enrolled in the program, and a cost savings of about $2.1 million as a result of healthy babies being born into the program. So that is about close to $50,000 per baby, not requiring those NICU services. So that's how we come up with that total there. And then we've dispersed over 10,000, about $11,000 worth of incentives have been dispersed to our participants since we started the program. So these cuties on the screen you see here are some of our babies that have been born into the program throughout the time we started. We had a couple set of twins, but this is one set of our twins. So these are our actual babies born into the program. So they're nice and healthy and chunky and cute and all of that good stuff. So and we have a couple moms that our facilitators keep in contact with, and they are still doing good. So we are happy to see happy, healthy babies born to smoke-free mothers and in smoke-free environments. So our team, we have a team of 4 with some offsets too. So you have myself, I'm the statewide program director for the program. We have Michael Lee, who services the Midlands and the PD area. We have Brianne Alexander, who services the upstate and the low country. And we have Crystal Irvin that services the upstate along with Bree, facilitating the program. So what we would like and what we hope from this roundtable is that we would be able to develop collaborations with any entity that sees the pregnant population on the call here today or on the meeting today. And if anybody's interested in getting a little bit more detailed overview, we can certainly schedule some time with the facilitators to come out to your organization or with your group and give a little bit more detailed presentation on the program. But basically what we want to do and what we would like to do is get more moms enrolled into the program, share that this incentive is there. So it's an extra added benefit and reduce those smoking rates of our pregnant population and have those babies born at a healthy weight, on time, and in tobacco-free environments. So that's all I have for the presentation. So Barbara, do we entertain questions here? People put it in the chat.
We do both. So I don't see any questions in the chat yet, but anybody who would, well, I do. We asked for one, ask for your email so that she could contact you.
Mm-hmm. Sure thing. It's actually in the, I'll send it, I can drop it down here in the chat.
And then Sophia asked if we could share the presentation.
Yes.
So normally, Sophia, this will go on our website along with the video of it, and you should see it there. But we can also send it out to registrants.
I see Michael online. Michael's one of our facilitators in the Midlands. Michael, can you pop in so everybody can see your face?
Michael's like, darn it.
Oh, sorry.
Hey, Michael, how are you?
Hey.
Yeah.
So quick question, Kim. I'm
Mhm.
sorry. It's more like a question suggestion kind of related. Is there any connection when it comes to baby and me and hospital postnatal billing discounts or something like that? I don't know. Did I just light up a light
No,
bulb to
not
that?
it's fine. No, not yet. So we would love for this to be a billable item on our
Okay.
end, as well as working with the hospital systems. But no, not at this time. It's nothing billable that we can
Okay.
bill at this time.
Okay,
Maybe.
because I know some hospitals they sometimes write off which we all know giving birth in hospital is pretty expensive. So and I was just thinking a lot of people after birth, that bill is something that goes with them for a long time. Having a baby now is not cheap. So I was just thinking, and I know that some hospitals they would probably either write off the bill or they would give a discount. And if Baby and Me can tap into that, that would be a major referral booster, especially for mothers that are smoking when they hear about that.
Right, right. Yeah. And then the problem with, well, the issue I would say with a hospital system making that change is of course it has to come from the top down. And we would love to get to a place where hospital systems are able to get some type of write-off or some kind of some type of billing if they refer to our program. So ideally, that would be lovely, but I don't know if that's going to happen anytime soon.
Understood. Okay.
Yep.
Anybody else have any questions? Does anybody have anything they'd like to share with the group about what's going on in their area?
Yeah.
No. Well, then
Group.
I know it is a very quiet group. Well,
I'm
we'll
still
send
seeing
out
people smoking. I just say that. Still seeing smoking, people smoking, even in the airports and public places. So it still seems there is work for us to be done. Our work is still being needed in places. So just a little comment from my side.
Right. And our teams are out in the community. The structure in the Midlands has a component with the community health workers. And so they're out in the community trying to get referrals into the program. Sometimes it's a little difficult because you don't want to assume that someone's pregnant, right? And if they're not usually open to telling you that they're pregnant and they're using tobacco. So it's kind of hard when they're out in the public. So that's why we rely on places where, mom would be confirming that she is pregnant, right? And then with a medical provider, they would be asking about tobacco use. So, our main goal for this year is increasing our referrals so we can increase our enrollments. But the referrals coming from a medical provider are going to be, our most that's where they mostly come from, and then self-referrals because they are identifying that they are pregnant and using tobacco. And of course a self-referral, which like I said earlier, we've seen an uptick in those from the moms who are wanting to get help themselves on their own. So we're happy to see that. But if there's any opportunity when you guys are out in the community and you happen to be somewhere where the pregnant population is, or people that service the pregnant population, we definitely would like for you to share that this program is available in the state of South Carolina, and we're able to service, our participants in a remote capacity, around the state. So we've kind of reduced that barrier of transportation, and COVID kind of led us into that, and we kind of stuck with it. So definitely, if you're in an environment where it can be shared, please do, or reach out to one of us and we'll make the connection there. See, Regina has a question.
Unmute.
Yep. Hi, Regina.
Hey, Kim, how are you?
I'm good. How are you?
I'm doing just fine, thank you. I know that before when Baby and Me was in the initial implementation phase, excuse me, having a little issue this morning. In the initial implementation phase, you had those focus counties, and now that you've, expanded to other counties and in the public health regions, what is the process for us getting started? Because we do have, or we've onboarded quite a few CHWs in the PD region.
Mhm.
So what does that process look like for us to get started in PD region?
Right. So right now, most of the referrals that we get from PD are coming from self-referrals. Like, so if mom is out there and she's looking for services for quitting, she's referring herself. So our primary targets, again, have been the upstate and the Midlands currently. We were talking with Suzette a little bit, and we thought we were going to have a mechanism to have a staff person or someone doing some part-time kind of Baby and Me work in the PD area, but I think the position, something happened with the position that it didn't go through.
Correct.
But we still can definitely service, and we can start doing a little bit of promotion. The only thing with that is if we start getting a lot of traffic, right? That might be a problem. We would have to get some staffing out there, and we can that's definitely a problem I don't necessarily mind having, if we can do that. But the current team that we have in place can definitely serve. So we can talk definitely with Suzette about that, and we can
Okay.
definitely get things started. And I think with the team we have in place, we should be able to manage. And if we get to a point where it's too cumbersome and it's too much traffic, then we can look at that piece of getting maybe a part-time staff person or splitting somebody's time that does the tobacco work. And that's just you. Who else? You and who else in the PD do tobacco work?
Well, as far as the community engagement
Mhm.
specialists, we have quite a few of our community engagement specialists that are doing a little bit of tobacco work.
Right,
But
right.
now that we've integrated the CHW program into the
Mhm.
region, then, we wanted to look at how we could expand that as well. So if it would benefit from both our community engagement specialists and our CHWs, then we
Mhm.
want to know how we can kind of integrate that into what we're doing. So
Yeah.
I'll get with Suzette, and
Yep.
then we'll
We
get
can
back
set up
in.
some time, and then we can walk through it. But yeah, we're
Right.
definitely, we are ready to do that.
Okay. All right. Okay. And we have some of our CHWs on the call, and we have our Hopper worker on the call today as well.
Okay, perfect.
All
Thanks for
right.
being.
Mhm.
Ms. Naismith Demery, this is Rajiv Mawat. I'm the director for the surveillance and evaluation part. I took over for Dan about a year ago. So
Uh-huh.
one thing also, just as a heads up for you at the PD region, is we're in the process of building or recreating the tobacco resource guide, and that's
Oh,
also going to have quite a bit of information, like the data related to the most recent adult tobacco survey, the youth tobacco survey, as well as other information related to all the programs that we have in-house, and that would be serving as a resource for all of you. And we're hoping to have that do that on an annual basis. So we are now updating that documentation, because the last one was 7 years ago. So we're
mhm.
hoping to roll that in by the either the end of this year or beginning of next year. So that way that can be something that you can always fall back on. And of course, we're always available. But that's something that we just want to throw out there as well, that you would be able to use as a resource for your CHWs, as well as like the leadership, to kind of like get an idea what different things are, how we are involved, what kind of like processes we can do, and essentially how that lines up with the work that you're doing.
Great. That sounds wonderful. Thank you
Okay,
so much.
thank you.
And Kimberly, we did have Sharia who says she's a community health worker and would like to know where she can find information to hand out when she's
Yeah,
out.
Sharia, where are you in the state?
He's one of our CHWs in Darlington.
MPD?
Hmm.
Okay, Darlington County?
Yeah.
Yes, okay. So we have materials available in the materials library with but if you just shoot an email to me, um we'll get some stuff sent out to you. Anybody that needs materials, if you just shoot an email to me, I'll get it situated and sent out to you just based off where you're located.
Okay.
And again, like I said, Bree is our team lead up in the upstate and low country, and Michael is our team lead for the Midlands and PD. So it would more than likely have Michael's information on it, because he would be the one that would be servicing the PD area. So Michael, we just make a note of that we'll get some information sent out to Sharia. But Sharia, if you send myself and Michael Lee an email, and Alexis, you're in Florence, okay.
Well, if you
It-
send it to Suzette, then she'll filter it out,
filter
because
it out. Okay,
yeah,
perfect.
she'll filter it out to the CHWs,
We'll
because
get
we
it
have
that way.
other CHWs. I think we have one on the just came on the call, Miss Cooper. So
Okay,
that would be good if you would just send it to Suzette and we could filter that out.
Or
perfect.
we can also like do it on a county level. You know, we may not
Okay.
have all the information, but we do have a source of information that we can break it down at the regional, state, regional, and county level. Unfortunately, our youth tobacco survey is at a state level. It was written that way, so we can't break it down any further. But all the same, for the adult tobacco survey and some of the other information like quit line utilization and those kind of things, we can then break that down, I think, to a further, to a lower level. You can see, actually, Yomi and I are sharing the same link, I think, but Yomi is the good-looking young man who is our epidemiologist, and he and I work together on the data pieces. So either through Suzette or through Kim, or I can even we can drop our emails into the chat. We can get direct data requests as well, you know, so we can provide that. So just wanted to throw that out there as well.
That's great. I'll speak with Suzette about possibly having you maybe to come and talk about those data resources that we need for our community engagement specialists in the region as well.
Absolutely. And any kind of feedback that we can get, because really for us, we're kind of like guessing sometimes what you need. And you, as the community, the folks who have the finger on the pulse, so to speak, you have a better understanding of what the community is asking or what their needs are. And if you can provide us with that feedback as well, that would be fantastic, because that gives us like kind of like a template on which we can start organizing our information, and to be able to provide it in a way that would be most beneficial to you. So just want to, yeah, thank you.
Thank
And
you so much.
Regine, we'd love to have you on a tobacco roundtable too, anytime you want to come.
Okay.
Well, I would love to, but as my
Good.
teammates would know, you'll only want me there once. Afterwards, you'll never, ever invite me again, you know? So.
I doubt
Regina,
that.
she said Regina. You heard the R.
Oh, I'm sorry. I'm sorry. I'm sorry.
I'm sure
Uh,
she, yeah.
Yeah,
Yeah.
yeah, old
I'd like
age
to
is
have all of
catching
you.
up to me. Yeah,
All
old
of you
age is
come
catching-
on.
Yeah.
Yeah.
Oh gosh. That's fine. That is good.
Well, thanks, Regina. I appreciate your interest in that. And like I said, we had talked to Suzette, and we were sharing. I were both getting excited. We were like, "Oh, Suzette might have a way for us to get down there," but it ended up not being what she thought it was going to be. But that
Okay.
doesn't mean it's going to stop. Again, like I said, we can service everybody in the state, and we're definitely not going to turn anyone away that comes to us, even though we're not heavily targeting there. But we just want to make sure we have capacity when we
Right.
do reach out there. We just don't want to share the information, and we don't have any way to service the moms. But like I said, I think with the team that we have now in place, with the traffic that we have, we'll definitely be able to service. And that's a problem we want to have, is that we have so many, people wanting to participate in the program, that we need
And
additional
we want to
staff.
be strategic in the way that we, do this. So that's why
Right,
it would be good to have those connections with you first, and then we can kind of
right.
start phasing it in. Mhm.
Right, and we'll the entire DPH family, like WIC and family planning, again, like I said, we're mostly targeting upstate and the Midlands, but
Mhm.
once we do move into with the community engagement and the community health workers and PD, kind of more specific targeting there, we would engage those DPH staff in
Okay.
those areas as well. Right. But we can definitely kind of manage right now.
And
with the team.
Barbara, I wanted to say that I've already spoken with Suzette about, and Regina is part of Suzette's team. So, we're all part of that. So I already spoke to her about coming in and doing a round table in the new year.
Oh,
Right.
okay, cool.
Great.
All right.
All right, everybody, there's some emails and phone numbers in the chat. If anybody wants to grab those quickly before we exit this meeting. Kimberly, thank you so much. It was a great informative presentation. And we last, I guess 2 weeks ago when we had our roundtable, this came up and a lot of people were very interested. So I'm so glad you were very timely. So glad that you came on.
Yes, and just to add, Lily did the last roundtable, and Lily is one of our like stemming hands. So the team, of course, is remote, and I'm in central office, and then they are headquartered in, the region. So Susan Collier and Lily are the on-site supervisors for the facilitators that are out in the region. And so, that's how they line up with the team. So all of us work closely together, and Bree actually reports to, oh my God, Lily, and then Michael actually reports to Susan on the regional level.
That's great. Well, thank you, everybody. So as a reminder, we will not have a roundtable in December. So I'm going to tell everybody now, happy holidays, and we will see you in the new year.
Okay.
All
Thank
right.
you, guys.
Thank you so much, everyone.
Bye.
Bye-bye.